what type of profit margins like would a typical dental practice like be making, in a typical year,
I would say, I mean, a healthy business would be at least like 20% retention,
20%.
right?
Okay, that's paying
20%
out.
retention.
Okay,
Yes, after expenses.
20% profits after all expenses. All right, we are live. Welcome to the Clinic Boss Show. I am Rick Lau, and I am your host. I grew and exited 127 locations, and now I'm on this journey to meet and learn from all these successful healthcare entrepreneurs in the world and how to get smarter in business and in life. And if this sounds like you're going to love our show. And today we got a special guest, Claudia Chan, and she has an incredible story, which we're going to get into. She's a dental hygienist, right? And an owner of a multi-million-dollar dental practice. And she's about to open up her second location. She's also a business coach, helping other dentists like to copy and paste her winning formula, And so, Claudia, welcome to the show. And I'm curious, like, do you remember how we met, Claudia?
Well, I started off using one of your service called Hero,
Okay.
one of the best service I've ever implemented, I have to say. Yeah, because I just implemented into my team that how important it is to engage with patients.
Yeah.
So yeah, it has all this.
And how'd you find out about Call Hero? Like, is it like Google? Like, do you remember
It was
who?
from a referral. It was from a
Okay.
referral, actually. So it was a
Nash,
referral.
right?
Yes, Nash was the referral.
And who's Nash?
Nash was my marketer. He
Okay.
was on my
Are you still
marketing
working with
team.
Nash or no?
No, not anymore. So yeah, so things changed. So
Okay.
yeah, but yeah, no, we're still in touch. So
Okay.
we're in good terms.
Cool. So Nash was your marketing agency, and I assume he was helping you generate Google ads and like patients
Yes,
to your clinic, right?
right. Yeah.
Okay.
So he was doing a lot of the SEO,
Cool.
the dental marketing.
Okay. Cool. Yeah. Yeah. I know Nash and our paths have crossed like many times. He keeps on wanting to like work to be a partner and anyways, so it's just cool to see how our paths kind of cross, right? But you do
Yes.
have a super cool story, and your story actually reminds me a lot like mine. And so you're not a dentist, but you actually own a multi-million-dollar dental clinic, and you actually hire like dentists, right, to work for a hygienist. Typically, it's the other way around, right?
Yes.
And I'm just curious. Maybe you could share that journey. Like, what was it like? Was it like difficult for you? Because there's a lot of ego working with like dentists, or even in our industry, like physical therapists or chiropractors. Everyone has God complex, right? What was that? What was that like? For you?
Well, I think it all started off with just being a dental hygienist and being employed, right? At a certain point, I mean, I got bored at what I was doing. And I feel like, I shouldn't be capping myself, my ability to build something. And then there was this talk, like, in the industry, dental hygienists can open their office running more independently. So I really took a deep dive into that. Yeah, it was more of like, yeah, I feel very trapped as an employee at that time. And I feel like, my limitation can explode. And so that's where I am. I started off as a clinical hygienist, and then turning into myself. I would claim myself as a business owner right now, a dental business owner instead, um, because of how far my practice have evolved from just being a hygiene dental practice, but now all the way, like you said, we are growing into the multi-million-dollar phase, and
I think
into
you
my
got
coaching
dentists and
business
you
as
got
well.
specialists working for you now, right? Is that right? Yes.
Yes. So I have, well, basically I have a team of 12, team members working together, including all the trimming coordinators, office manager, the team of clinicians. We have dentists, prosthodontists, surgeons, denturists that work with us, not just a hygiene clinic anymore.
Wow. Wow. And so
So,
what was it like hiring your first dentist?
um,
Was
well,
it
I guess
hard?
it wasn't hard. I wouldn't say it was hard. Like, it was more of like a you would have to communicate. I would say like it's more of the communication of not really having the hiring branding on top of that. It's more of working together, collaborating together to maximize like, our standard of care, right? So pretty much providing the best care together.
Okay. Super cool. Yeah, I know, because your clinic out is in Markham, Ontario, and I think you're about to open up a second location as well, right?
Yeah, so we're looking into it because we did hit capacity for current location.
Yeah. Wow. And so, I've always been fascinated with like the dental profession, because it's very similar to like, the physio. Actually, let me back up. It's the profession that physios and chiros kind of wish they were at, So, and I'm just curious, like, what type of profit margins like would a typical dental practice like be making, in a typical year,
I would say, I mean, a healthy business would be at least like 20% retention.
20%.
Right?
Okay, that's
20%
paying out.
retention.
Okay.
Yes, after
20%
expenses.
profits after all expenses, right?
Yeah.
Right.
So that would be a healthy business model. Yeah.
Yeah. And so, and then is that the average, or like most clinics are like closer to like 10, 15, or like, are they closer to like 25, 30?
I could only speak for myself. So like, as we're at like, a pretty healthy 20%. But of course, like with current economic state, it is squeezing everyone's profit margin right now with inflation and the staffing costs right now as well.
Yeah. Yeah. Because I would say a typical like rehab clinic, I would say like the really well-run clinics who are doing like multi-millions is part hitting those type of numbers, like maybe the 17%, but most clinics are kind of stuck around 10%, right?
Yeah. Yeah.
And then I'm just like, at 10%, is there enough like juice in the business to like, to run that business, right? Because running, because it's a lot of work to run a practice, right? So
there's a lot of strategic planning, I would say, because there's a lot of variables, because you cannot control who comes into your door, and it's same at some point too. But yeah, I mean, strategic planning and execution is the key.
Yeah. And then for a typical dental patient, right? What's the lifetime value of a patient worth to your practice?
I would say if it's a general dentistry, you're looking at a minimum of $10,000.
Okay.
That's
for
like,
how many years?
Like
how many years do you include for that? Like, what's the model?
Well, if the model, like I said, as general dentistry, like you're not doing extensive cosmetic work or any other, I would say any other like prosthesis work and all replacement work, then it's just maintenance work. Like you're looking at like that $10,000 ROI is pretty much the 10 years, I would say.
Okay.
Yeah.
Okay. And then what's the annual value of a patient, I guess it would be 10,000 divided by 10, so $1,000 bucks.
Like $1,000 to $1,500, I would say.
Okay.
Yeah.
Okay. Wow. See, this is what I mean by like the envy people in like rehab. Like for most like physical therapists or chiropractors or massage therapists, like a patient typically is, sure, it might be worth like $700 or $800, like like maybe like call it like per episode of care, right? But they don't come back every year for the next 10 years. It's not like a recurring subscription model,
Yes.
So
there's a lot of implementation of comprehensive care as well in dentistry, I would say. If you're not implementing that, like it's hard to maximize that $1,500 as well.
Okay. So that's my next question. So what would you say are 3 things that you're doing right now, right? At your practice that keeps patients like kind of like coming, right? Like reactivating them, like what has been working for your practice? And once again, like, like you're doing some amazing stuff. I've always wanted to like interview like, someone like you, like a dental practice owner, and because there's so much that we could learn from the rehab industry, like on how dentists like are doing this, because they're doing it really well. Like I would say, like they're running a pretty like tight shit.
Mm-hmm. Well, team culture, definitely team culture is one of the biggest thing, because you cannot do everything alone. That's my theory. That's my biggest belief as well too. So fostering a good team culture, that's like a continuous thing that I would say any business owner should be doing. Fostering a good team, positive team culture, implementing a lot of team trainings to your team. Patient care, looking at patient care, like we were just saying earlier, like how do you maximize that, right? So comprehensive care, educating the patients, so that they have a good understanding of what you're doing. So not just being dictated by, in the past, like, the older model will always be the clinician dictating treatment. But right now it's more of like a collaborative style method with the patient as well. So then they know what you're doing as well. Like what benefits do they get with the treatment? And then one thing that I'm actually really putting more and more time right now is actually AI. So this is the newest thing in the world happening.
AI in dentistry?
Yeah. So there's a lot of AI stuff happening around us. And there is some technologies that's starting that I'm more aware of is helping to efficientize the process of care and simplifying tasks for your staff, your team, increasing the treatment coordinating and treatment acceptance for clinicians as well. So AI is like definitely something that I am currently putting more effort and looking into it.
Okay, interesting. Everyone's using AI everywhere. So, but if we zoom up tactically, what would like the typical like patient journey look like? I call your clinic, I book, and I get my what do you do in your new visit again? Like you do that new visit, like what do you guys call it in your term?
So new patient journey, I would say.
Okay. So they come on the first visit, right?
Mm-hmm.
And then what do you do after the visit to, like, I guess the next step is you book them like a cleaning, right? Am I right?
Mm-hmm. Yes. So more of like a comprehensive exam and a cleaning. That's a very typical way to start. So then we get to know the patient, their needs and their goals.
Okay. And then what happens afterwards? How do you get them to come back again in the next 6 months, so that they don't, how do you make sure that they leave with an appointment booked?
Well, that has to do with a lot of patient experience involved in the whole appointment. So validation in terms of your team members, everyone having that trust implementing to the patient. So then when they exit out of the appointment or the treatment room, patients actually being, having that comfortability, that confidence in the team. So not just with the clinician, but with the team. So this is like a driving force for a team the patient to actually really coming back to you, having that trust. So that trust building.
The hygienist and the front desk as well. Like that's what you mean by team?
Yes, the whole team. So from the front desk, like you said, from the bookings, starting from the booking, phone calls, and then coming into the office, like, the meet and greet from the dental assistants, the hygiene team, and then they introduce to the doctor. And then from there, the doctor, having this devising a very personalized treatment plan, not really a cookie cutter. It's building trust. I would say that experience that you implement with the patients, has a lot of that you're implementing a lot of confidence for the patient to come back. So not necessarily that you're always hunting them down to come back to you, because they want to come back.
Okay. And what % of the people actually book their next appointment, after their first visit for you?
So my clinic reappointment rate is 98%.
That's insane. Okay, so and how much of that is driven by the is it driven mostly by the front or the hygienist or the dentist?
Again, it's actually everybody involved in this, right?
Okay.
So the doctor has that urgency addressing the issues that they see in the mouth with the patient. The dental hygienist is actually putting a lot of effort in educating the patient as well, right? And at the front, basically, when you're doing the handoff, the treatment coordinating part from the front desk and your treatment coordinator, like really step up to explain, like, the financials, so patients are not in the dark.
Okay. Wow. This is amazing, right? Because what you're describing is exactly how clinics, like I think rehab clinics operate very similar, but they're not dialed as efficient as like how a dental clinic is being run, right?
Yes.
Like
well, yeah, I would say,
right?
I can only speak for ourselves. So I can only speak for ourselves. I mean, like there are like, offices that are trying to refine their journey, like I said, like the new patient experience. But I think, most of the time, like right now, dental clinics are really trying to get the patients back and like the reappointment rate to get up. Because you really don't want to have the patient just walk out of the door and then chasing them down. And then creating more work for your front office as well.
Okay. And is that your most important like KPI that you look at each week then? What your
Yes.
Okay.
Yeah. So this is one of the treatment conversion, the treatment acceptance, and then reappointment rate. Yeah.
Sorry, can you say that again? Can you say that again? What are the metrics?
Treatment, so the treatment case presentation, so the value of that. The treatment acceptance. So that's also a value of that. And then also the conversion rate in terms of rebooking the patient back, the appointment rates.
Okay. So what's an example of each of those metrics, right?
So I like to track our treatment presentation in terms of value instead of percentage. So I know that some clinics, they love tracking in percentage wise, but then to me, it's like, okay, how much in terms of the value are you creating for that patient? So that presentation,
like, is it annual value or is it the 10,000? Like what number?
So it would be like a full treatment plan. So the comprehensive treatment value that you're presenting. So
for the next
are
visit,
you just talking? For the whole year to come. For the whole year to come.
Which is
so basically
at the
or minimum $1,000. But if you're doing more extensive work, like our practice is like multi-disciplinary, you're looking at like having patients walking out with a $10,000 plan.
Wow, that's insane. Okay, so the metric you keep track of is like, okay, this is like how much you could bill in essence with that patient leaving. Okay.
Yeah.
And then, what's the second metric? The patient acceptance?
The second metric would be acceptance. So the acceptance, in the past, we did at one point we were tracking the rate, the percentage, but then it's not the most accurate reflecting too, because I mean, you can have like 3 cases and then 2 of them were accepted, 1 wasn't, and then you're still only getting 60% rate, right? So it doesn't reflect like a very positive number for the team. So, but in terms of, so if you wanted to like, implement more encouragement to and positive encouragement to your team, I think it's the value that they see, right? So, I mean, say this week we presented say $30,000 treatment in total. I mean, if the team sees that, okay, we're closing like, 2,500, I mean, that's very encouraging. And that also creates the next step to drive more encouragement and growth for your team, which is the bonus status, right? So that also will translate to that too later on as your practice grow.
So that 2,500 is what the team estimates that this patient will be okay based on their insurance funding?
So they actually so that we have a team working with patient in terms of finances wise, like you deal with like what is the out of pockets and then also the coverage for the insurance, the benefits. But I mean, we all know that insurance company, they don't cover much. I mean, a maximum of like maybe like $2,000. But then if you're presenting a $10,000 case, then there's only so much that insurance will pay. So that takes team effort to drive the value of the treatment or the dentistry, the patient.
Wow, this is insane. These metrics that you have, oh my gosh! Like I would love to see the physiotherapy or rehab industry like do this. This would be like off the hook, right? And then the third one is the rebooking, right? Which is you said is
the rebooking.
Yeah, you call it 98%, right?
Yeah, that's definitely a very important metric because that's
Yeah.
where the revenue cycle management comes in too, right? So
Yeah.
you're
Wow.
having that rinse and repeat.
Wow. Insane. That was cool. That was super, super cool. And then what do you do? Okay, so let's just say, because I think typically the general cleaning is like every 6 months, right? Right?
Yes. So with no active disease, periodontal disease, that would be 6 months, active 6 months.
So
But
what do you do for the people who don't, that 2% that don't book, right?
we would have tried it. Well, I guess we would see like where they're coming from too. Like as a clinician, as a team, like why didn't the 2% book? So it could be financial issues, or it could be maybe we fail as a clinician or as a clinic that they couldn't get the education from us that
This is amazing.
the
So you
importance
actually
of
do
it.
team reviews, right? Between the
Yes,
team on that
yeah. So
specific like client on where did we fail that this person didn't rebook?
yeah, so I think self-reflection is very important, right?
Wow.
So there's always something we can learn from a failing experience,
Yeah.
and we try to improve that. That we'll try to dial that up.
You know what's interesting, Claudia? Like a lot of business owners talk about team. I think you're actually implementing it. Since just talking. So I'm curious, how do you take out time in the schedule to do these case reviews, or is it just done organically?
We do team meetings. I have a leadership team that we do team meetings together. So we look at it as the people that's actually really leading the team. We do that discussion together. So as leaders, we self-reflect, right?
Okay.
So is there something that we're not doing that causes this kind of setbacks?
Okay.
Right. So instead of really blaming on a team members not really
Yeah.
performing, have we as the leader really reflected on have we communicated more the clarity with your team yet? Right.
Okay.
Because
So
you
these are just
can,
leaders who come to this, but not the clinicians,
yes,
right?
not the
Okay.
so so the head clinician would come in too.
Okay.
So yeah, so we would basically have this talk together. Like every week
Okay.
we'll come together having that leadership meeting.
Okay.
Yeah.
This is probably your most important meeting then, because this is real money, right? This is not
It is.
like strategy about what to do a year from now. This is like what happened last week, right? Right?
Yes.
One by one, right?
Yeah. So we come in and basically we look at a scoreboard or KPIs, why did certain numbers went down?
Yeah.
Do we really have to pay attention right now to, I mean, because you don't want to wait until something really fall off the cliff, then you start to addressing it. So these important, I believe that is very, very important. And that's where you actually foster a really good team culture in general.
Well, you have to. So what does your org structure look like? How many leaders do you have in your little box, right?
Well, definitely the visionary operator, and then we have admin operations.
Okay.
So because we're not a full DSO structure yet, so I haven't really split into the HR departments and all the the tedious departments. But then we have the main operations, admin operations, dental assisting operating, dental hygiene departments, and the dentist, the head of the dentist.
What's the difference
department.
between dental assistant versus dental hygienist department?
So dental assistant definitely are the people that are running the floor general. So they got to make sure that the traffic is patient seated properly, the operatories are ready, records are ready for the clinicians prior to starting.
Okay.
So they also play a very, very important role. I always say dental assistant is one of the hardest jobs that they have. They have to really get
it's
into
not the front, right? It's
starting
not
the report.
Do they do the front too, or they just do that one specific role?
They only do that one specific role, so dental assisting. Okay. So basically, it's more of the back office. The front office, basically, is more of the patient engagement, really all the administrative tasks, communicating finances. So I don't have any of my clinicians communicate or talk about money with the patients.
Okay. Wow, that's crazy. That's super tight. I love that. Right?
Yes.
Cool. This is cool. I'm very fascinated.
Yeah, I think creating that clarity of the roles and responsibility that your team has is very critical. So nobody is in the dark. they know exactly what to do when a patient walks in.
Claudia, you know what's interesting is that like I've always admired the dental industry where like they actually have like this team-based role. So they got the dental assistants, they got the dental hygienist, right? You know, and everyone focused on one aspect of the patient's care. And so that the dentist does maybe like this type of work, you know, right? You know,
Yes.
and then the hygienist does this type of work, but together their productivity is insane and the patient care is off the roof, right? You know, whereas
Yes.
when I look at say like the physical therapy industry, right?
Mm-hmm.
They still is a little backwards where they want to do everything themselves from them like you know treating them to doing exercises to putting the machine on to wiping the table to like you know like to get walking them to the front to like you know like talk about money and like you know like they do everything and some of them even like books with them and so and then like you know like in our industry which is I think is very similar to the dental industry is that there's a shortage of like people that want to work in this profession, right?
Yes.
But the demand is here.
Yes.
Yet, like, if you don't embrace in a team-based care model, how do you service all these people that want physical therapy or chiropractic because like you work on this one-on-one model, right? You know what I mean?
Yes.
Whereas a
Yeah,
dentist,
it's going to create a
one-on-one.
lot of burned out, basically.
What's
If
that?
you're doing you're creating a lot of burned out clinicians if you're doing this, right? Like on a person doing it all, versus the team that's handling together. Because basically you still want to preserve the health of your team at the same time
Yeah.
too. So yeah, teamwork. I can't address more how important it is. Teamwork.
It was funny when we first started this podcast, you were talking about how the dental profession is very outdated, you know, and then and I look at the physical therapy profession, I'm like, oh my gosh, we are outdated. We're still on one-on-one care, right? Versus like a team-based model, right? You know,
Yes.
and once again, like I think all industries are going through the same same shortage of like hiring, whether it's a dentist or a physical therapist or a chiropractor, right?
Yes.
But the demand is there.
Yes.
And so
Demand is always there. There's always a lot of dentistry left undone.
yeah.
It's just that, yeah, like you said, I mean, especially nowadays, like of the shortages, it's insane. So it's more than ever that it's so important that having a good team to deal with this with you.
So Claudia, I know you're a business coach for like dentists and hygienists, right? You know, if you were to take on like a client that was a physical therapist, what would you say to them to transition to this team care type of model, right? You know, like to work with like a physiotherapy assistant, you know, so that
Right.
not only can they provide better care, but they could like double or triple productivity, right?
Right. So I mean, goal setting. Basically, I think you have to have a clear goal, what you're trying to achieve as a clinician or as a business owner, right? So as a business owner, definitely business owner slash clinician, eventually you wanted to step out of the clinical role. So in order to do so, that trust building with your team is very important. Like the delegation part, like freeing up your own time, doing what's most important that you can deliver to the patient or to the business is I think this is what they need to really focus on. Like the most important thing is not really wiping the table, like you said, or like, you know,
Or doing the
really doing
exercise
that.
plan, you
That's
know,
it.
right? Like,
Yeah,
why not have the assistant do it or the kinesiologist do it,
exactly.
right?
Yes.
Why go home and do the home care plan when you just do it at the clinic, right?
Yes.
Do you know what I mean?
Yes.
Can you imagine giving a patient like a home care plan? Like, would they actually do it? Likely not, right? In your
No,
world.
no,
No.
no. It's just like an OHI plan. I don't think many dental patients actually will
Okay. Can we talk about the
replicate.
finance? Let's talk about the financial piece. You're saying that like so your front deals with talking about the financial talk. Typically, how much would you say is covered by out of pocket versus like by insurance? Is it 50-50 or is it 80-20 covered by insurance?
It's I would say 80-20. 80-20. But if you wanted to do really the dream dentistry, dentists wanted to do all the dream dentistry, most of them will not be covered by the dental insurance. So that takes a different skill set for your team to really sort that out with your patient and value delivering. I think that's where it's critical.
What do you mean by that? Value.
So they have to see the value while you're doing certain things. The patients need to see the value, not just you. I mean, as a clinician, I mean, you know that
what's value?
It's beneficial. It's beneficial to a crown, but then for a patient, it's like, okay, what does the crown do for me? So they have to be able to see that value, right?
Okay.
So it's not just. That's what I was saying like earlier. That is, the older model would be that the doctor will dictate that service or that treatment, but the patients have no clue what they have done. But I think in modern times, I mean, patients are being more educated as well. Information is so easily accessed. Patients want to get the best service right now too, not just I need a cleaning, I need a crown, I need a filling. They need to see what they get out of it. And
wow,
and
this is bang on because it's like, I think like a lot of clinicians in our community, like when someone comes for physiotherapy, like they just focus on, I'm going to fix their shoulder. Like they came in for a shoulder pain, but really they came in because they want to play pickleball and their shoulder is bothering them. So they should be, when you're talking about value, it's really the value is about getting you to play pickleball again, right? Let's get your shoulder like done, not like, just looking at your shoulder. I want to like your shoulder and let's mobilize this or blah, blah, blah. Right.
Right. I mean, especially in the dental industry, a lot of dental diseases or problems, they go undiagnosed, right? So patients don't feel the pain because these are all chronic diseases that they're having. And as a clinician, as a dental professional, that's our job to be able to articulate that or to send that message across to the patient that there is disease happening and how would it affect them in lifestyle wise too. And I think this is where the value of the actual clinician and the team will come in, because educating the patients, getting your point across, right, having them understand. I think that's where the win comes in for us. And that reflects in that reappointment rates.
Wow. That's amazing. That's super cool. Okay. Wow. That's amazing. Patient is worth like $10,000, like annual values of $1,000, like this team-based care, focusing on the patient's why and showing value, not just like treating the condition, right? It's what they result in the outcome of like what life they want, right? So love it. Everything that I live and breathe, like you're saying it, and we are in two different industries, but your industry is way more profitable. So I like your industry. Let me ask you, what would you say are the top three things ways that you attract like maybe new leads or patients to your practice that has worked for you?
Well, definitely online, dental marketing, online marketing, Google Ads.
Okay.
Yeah. So the positioning yourself, finding your target audience. I think oftentimes when the clinic owners try to position themselves, like they're trying to be the one that's for everybody. But I would say that, So, I mean, as much as you're doing multidisciplinary within your practice, again, you wanted to have people that understand that has the same mindset with you too. Yeah. So attracting the right patients coming in through the door is also
what's the ideal patient for you?
Patients that are willing to, being open-minded, I would say, because we have especially our model is I have like different specialty, that's different disciplinary dentists. We all do what's our strength does. Like we basically do what we're good at. So as there isn't like a super dentist that and then just do it all. So we do it in a way that we provide the best care for patients. So I do best like safer dental cleaning, and then the general dentist like the best doing that the simple restoration, and then but he wouldn't pull the heroic move doing a surgery, right? So then there would be a surgeon that does that.
But how do you market for that?
Positioning yourself.
But how do you
So we
position
do.
your market?
I position ourselves in terms of you get the best patient experience.
Okay.
And that would translate when, like I said, like earlier, like when the patient comes in, starting from the phone calls, that we would be able to help you.
Okay. So Google Ads is number one. What else? What else works?
We've been doing a lot. We did do the banner ads. I've heavily focused on Google. So we also did banner ads. So where they download say implant guide. So if they want patients looking into dental implants, then they can download that. So it's more of like an education process. So patients, prospects, I wouldn't say patients at this point. Yeah, the prospects that are interested in you will start Googling, looking it up, reading more about you, the service. So I think that creates a lot later to come through the door. And then they basically start to build confidence with you when you're doing this. I believe in this route as well too.
Well, my entire business is built on this, and I love the fact that you're doing this. You're creating content where people like fill up, like you get their email address, maybe their phone number, right? So all of a sudden they're in your monthly email newsletters, you're sending them content, and then you got like ads, following them, if they go on CNN or they go to this website or on Instagram, and just reminds them of like that guy they downloaded, or or like smiley teeth, right?
Yes. So it's like a good education process. I mean, like a lot of people are having dental phobia. You have to understand that too. So they will not be the person that really just click on it and just come straight to the door, come straight to your office. So that trust building, that rapport and education, that's part of the marketing that we do as well.
What about community marketing? Do you do much like community marketing or like Facebook groups and stuff
I haven't had a lot of success in Facebook and Instagram. I would say those are more of like drawing attentions. So I haven't really been doing a lot of that. So like I said, I've been just focusing mainly on branding on Google, my website.
Okay. And also like SEO search, when someone searches like best dentist, like best patient experience dentist in Markham. Or the best
reviews. Well, definitely Google reviews like helps a lot too. So.
Yes, Google reviews, right? Everyone, especially with like people who have like dental phobia, like they're gonna check out the reviews. Like my wife will check out the reviews. And the ones she will look at, she only wants to look at negative reviews, right?
Yes.
So she will look at the negative reviews and she only wants the big ones, or she looks at positive reviews, she will also look at only the big ones because they usually like, and she only look at the female ones, right? Like people like so, but that's super, super cool. And then what about in terms of, so we talked about like what you do to attract new patients. So what do you, because each phone call or lead you get is $10,000 right now, right? It's very expensive for you not to convert that phone call. So what are you doing to improve the front desk conversion of these marketing leads? What would you say are the top 3 things that you're doing?
Definitely phone training. Phone training is, I think a lot of clinic owners do neglect in the past. They think that the patient calls and they will book. So often with the competition ahead of us right now or within us already, phone skills, your front desk phone skills, like it's something that you cannot neglect. And this is where Call Hero comes into. Like you guys have a very good, extensive phone training, and I have to say that we've been using that as our base too, like offering that help, providing that comfort over the phone, so then the patients, the prospect will book. So phone training definitely it's the top priority. And again, then it'll come down to metrics. So we look at call conversions. So how many leads comes in, and we listen to the calls. Oftentimes, like we do listen to the calls, and we
Every
would
single
do.
week? Is this part of your case review, or like you have a
That
separate?
would be the admin operation, the leading the team meeting. So they would they would pick out the ones that not successfully booked, and they'll look at what the problem is. Like, is it a money issues, or is it just location problem, or they call the wrong number? So we look into all these factors.
Okay. Wow. That's crazy. And so, yeah, no, that's super cool. You know, the fact that you do that. And I think the way you have to picture it is that, like, for every single phone call that's missed or not booked is literally $10,000. So if you see that, you're like, oh my gosh, you know, especially if you're spending a lot of money on marketing. Google Ads is very expensive, right? You know, or even like Google SEO is very expensive because you got to pay people to do it, right? You know, so if you join in these calls, like, and they don't book, then it is like definitely like you're losing a lot of money on the table, right?
Yes, it is. And then, well, that's why we would, I mean, we always have a plan. I have my admin team basically reach out to the ones that hasn't booked, or people that would be like, I'll call you back, or I think about it. I mean, in a couple of days, you do want to reach out to them. And I think it's a good self-reflecting process as well for them too. Is this something about us that they didn't like? So it's more of like, you know, it helps, like, you know, the practice in general as well too. Is it because we cannot serve the patients? Is it, you're looking at, like, is it the capacity issues, the scheduling issues? Maybe it's not necessary, like, you know, just the phone skills, right? It could be like our capacity. This is when you look into growth, operation problem, right? And you want to see, well, this is when you know that you're possibly hitting capacity as well. So how do you resolve that? I mean, you're getting a lot of incoming calls, but then you just cannot successfully book them because you don't have enough chair. Then that's when the growth, the growing, the scalability of the business has to, we really have to look into that.
Wow, that's super cool. Let me ask you, like, you know, like, obviously there's a big trend of like online, you know, right? Like everyone's online, you know.
Yes.
If you look at like patients who book with you, right? How many actually book, like a new patient booking through the like the phone versus booking like online, you know, or through?
I would say a lot coming online, because I do have an online booking system. You'll be surprised how many people are, I mean, people are really busy as well too, with work, with life, with families. Like after hours requisition is pretty high for us to offer the online booking.
Or is that booking the schedule, or those just web forms?
Just a web form. So they put their preference in terms of their availability. And so the next day, our staff would follow up right away, right? So yeah, online booking, I think is very, very important for clinic owners to address that.
Patients,
not just the phone.
50-50, or do you think it's 80-20? Like, what's the breakdown between online and phones in terms of converting new patients, right?
I would say it would be, I think online is actually heavier right now. I would say like 60-40 right now. Yeah. Because a lot of people are just like, you know, like you said, I mean, Googling, they're trying to read the reviews, like who's better. And then that's when they make the decision online. But with life getting ahead of everybody.
When they fill out that web form, like they're not booking directly in your calendar. They're just filling a web form. And then on that web form, you have to call them back. So you're still using the phones right now. Am I right?
Yes. Yeah, exactly. Yeah. You still have to reach back the outreach to the patient.
So that to me is still the phone. Like, but I guess my question is, like, you don't allow a new patient. Why don't you, would you allow a new patient book directly online as a new patient?
No. I think in terms of.
No? Why not?
No, because it's hard to control, because, like, you know, what you really want to develop that, like, again, and it's more of like value developing with the patients as well, like over the phone, like, you know, the service, giving that experience, because I mean, having an actual person, that human touch, I think still makes a big difference of why people choose you over another clinic. the emotional attachment is still there, I believe.
Okay. The reason I bring this up is that like I see a lot of like clinics in our community where like they're pushing like just book directly into my EMR as a new patient, right? Versus
Yes.
pushing the phone call. But then
Right.
like that's their main call to action. Like go book in my Jane software like directly as a new patient, but they're not actually getting a lot of new patients booking from them. An existing patient may book because they know who you are, but the new
Right.
patient is not booking because they're still like they want to talk to someone. Like, what is it like working there? Like, I
Yes.
have like more questions because I have a dental
Yeah.
phobia or I have these type of issues,
Yeah.
and like right is
Yeah.
that is that kind of the main is you're it sounds like you're
Yes.
is there
Yeah.
some
So basically you still want to hold down to the no-show rates to zero as much as possible or as low as possible, right? If I think that if you're just allowing patients to book anywhere on your calendar, it creates a lot of unnecessary cancellations too. So I still have my team basically control our schedule. That way, again, it comes down to, the value pitch from your team to the prospect. And that initial connections with your team and the prospect is very, very important to me. And that's
yeah.
where they see why they should choose you over anybody else.
Okay. Love it. Yeah, because like just talking to from business owner, that first phone call is a sales call. How can we
It
convert
is.
that phone call so that like they're like, this is the best clinic for my problem, right? And I'm
Yes.
gonna have a list of all these questions because I have a phobia with like dentists, of them scratching, like burning my teeth. Okay. And is it a
Well,
passionate
exactly. I mean, like with with the dental phobia, traits is really hard because like people really need to have that connections, that emotional connections with your team,
yeah.
and I wouldn't take that out of take the phone out
Oh my
at all
gosh.
costs.
I love it. And I just wanted to recap what you said originally. When you said 60/40 is them filling out web form, requesting a
Yes,
phone call back, not booking directly
yes,
into EMR because you want to
yes,
control that because you want them to talk
yes,
to a human so that you have a
yes,
higher conversion rate, right?
yes, correct.
Okay.
Yeah.
Awesome. Okay, cool. And you know what? Like everything you talked about, like is everything that I preach within our community is that there's like running like running a clinic in 2024. There's 4 things you need to do. Like number one, you have to be really good at marketing, okay? Which is generating leads, phone calls into your practice. Number two is you have to be good with like front desk conversions. So if that lead comes
Yes.
in, you got to make sure you're converting at like 80% of that lead into that first appointment, and then if it's done right, that first appointment will turn it into a $10,000 plan of care over for 10 years, right? In your clinic, right, Claudia? Number three is you got to be
Yes.
amazing at patient experience, or that patient is not going to come here again after the first visit, right?
Yes.
And the last thing,
It's just like going to the restaurant.
yes, 100%. And number four is you have to be outstanding at staff experience because no one will want to work for you, or like, if you can't create an amazing staff experience for people, like an opportunity for your practice, right? So, yeah, what do you think about that? Do you agree with that, Claudia?
Yes. Yeah.
Okay.
I totally agree on all of them because you got to keep your staff happy. So I mean, the saying is keeping your staff happy will always definitely keeping your customer happy.
Yeah.
That's something I truly believe.
Yeah, cool. So you've been a customer for Call Here since 2018, and I think
Yes.
I'm going to say that you were a bit of the early adopter with like AI before everyone started like hearing about it now, and so I'm just super curious, like, what was the main problem that you faced before using Call Hero, right?
I would say you cannot it's more of you cannot control the problem without the call recordings and call tracking. Oftentimes your front desk do lack of that skills in the beginning. because we just put them on the spot, just answering the phone. And we, like, again, that they don't know what the patient experience would be unless you implement that training. With Call Hero, you're not really implementing a negativity mindset to them that they're being listened to, but rather than like you're trying to tell them that it's an education process to your team. So it's a growth process. So this way, it's also creating a very positive career pathway for your team member as well too, because eventually they could become a phone trainer, admin trainer, a lead trainer, and yeah, this experience using Call Hero is, I would say, it has been amazing. It's implemented a lot of positivity into the training process and the patient experience process as well too.
Interesting. And then what would you say, what type of results you've kind of achieved with Call Hero, right?
Well, definitely like you implement the accountabilities in your team. That is the biggest achievement, I would say. They know how to handle call properly because like we were saying, the initial phone calls like can cost you like $10,000 basically ROI. So you really wanted to, how do you maximize that? Then that's the first step.
Yeah. Wow. And then, like, and I was looking at some of your call metrics, like, you're like answering at 95% right now, like your conversion rates are decent as well. And so I had a big impact on that as well, right?
Yes. Yeah, you really don't want to have someone going into your voicemail because that's the next thing would be they might be calling the office next to you.
Yeah, maybe talk about that. Like, is that something that you see a lot? Because I think a lot of clinics like, yep, it's okay with going to voicemail, right?
Yeah, and I truly don't believe in that. I think, well, that's the thing, especially when you're doing Google Ads, people are basically going through that list, showing the top 10 clinics or top 5 clinics. So if you show up on number 1, then you should be the number 1 person getting in touch with the patient. If you're not answering the calls, basically it's lost opportunity, you missed it. And they're moving on to another list because that trust hasn't been, or that rapport hasn't been created with a human. With your team. So I think that it's very important that they really need the answering rate is just as important as conversion rate.
Yeah. Wow. And do you have and do you give bonuses and reward your staff based on like KPIs like related to this or?
Not at the moment. So I think everyone is very content at this moment. I think that's because I would say like, implementing bonuses, it can be very tricky. But at the same time, I think it does create some sort of rewards, but we haven't done it yet. But if you have a true positive team culture, I think that, if your staff is happy working with you, like we're also delivering all this positivity experience to patients, they want to do well with you as well too.
Yeah. Wow. Cool. That was awesome. That was truly awesome. I really enjoyed this conversation, Claudia, because there's so much parallels with the dental industry. And when I hear about what you're doing with other, you're a business coach, you own a practice, you work with other practices, there's just so much parallels. And I feel like, the physical therapy, chiropractic, like industry has so much to learn from like, business coaches like you on the dental side, but I feel like you guys got it dialed, so.
Yes.
Yeah. And now you're thinking of using AI.
Yes.
to improve the operations of like, is it the insurance verifications and like just all the back end process stuff?
I say it's still like I'm using it to elevate the patient experience still.
Okay.
I mean, there's always ways to, create that trust. There's just a lot of skepticism in dentistry with patients, and that's a whole dental phobia scenario too. Having AI will definitely reduce a lot of human stress. Okay,
cool. Last question before we wrap up. If you only had $1,000, Claudia, right? How would you spend it, like, so they could generate sales next month, for your dental practice? Like, what would you do if you had 1,000?
Implement a new AI technology. So right now I'm still looking at a really technology like team training. I would say I would split it in both.
Into team training,
implementing
right?
into team training and AI technology. So like I said, AI technology is used to reduce the human stress, to amplify efficiency and increase productivity. And team training is very important. I think it's
So team
a
training with like
continuous
conversion
investment.
rates, right? Booking those plan of cares, or answering those phone calls and converting them, into into an appointment, right?
Yes.
Yeah.
Yes.
Okay. When I hear about like what you're doing, like I feel like the dental profession is like so many years ahead. And like, our profession can't like even see it. Like they're so stuck. When you talk about like in the old ways, like I feel like we're in the dinosaur stage, right?
Is it really that bad? I think it's also because we have so much competition as well too. With
The
the
competition's
corporate
the
coming
same.
in, yeah.
But like
That's the
even
same.
even that whole thing about like the one-on-one care versus team care,
Mm,
like that itself is something. There's just so much pride with like the profession of letting it go that they don't want to work with assistants, and it's
yeah.
taboo to not do one-on-one care. Do you see what I'm saying?
Yeah.
Yeah.
I mean that's definitely the older model. And I do see a lot of dentists being stuck in that in the past as well too. They just haven't created that trust with their team. I would say that would actually is a trust issue more than are they really wanting to explore the new way of practicing. Having
So
that,
dentists still
creating
operate
having
like
that
that or
trust.
no?
Some of them don't. Some of
What
them
percent?
still.
It's very small, right? Isn't it?
Well, I think the newer style, like that you're trying to really compete with the corporates. Like you have to get into this model, because
Okay.
otherwise, it's just too much burned out for the clinician, the doctor himself, and like if it's everything like 1-to-1, it's too hard to maintain, and that's also the cap that you're putting on your productivity too, right? So you're not growing in that sense, because at some point like there's just one of you, right? So you can clone yourself. The only way to do that is through team practice.
Yeah. Yeah. Like,
Yeah,
and
that's the key
it
to break
boggles,
through that multi-million
it boggles my
production.
mind because like all these all these owners like can't hire another physio, and we're like, just use an assistant. We'll
Mm-hmm.
even help you train them.
Exactly.
But
Yeah, then
they
the
can't even
clinician can
embrace it.
do the
I
important
think the
stuff.
owner can embrace it, but the clinician can't embrace it because it's a industry problem.
Really.
Yeah. But you see like where the like what I mean? Like
Yeah,
it's
because
like
they have to change that mindset. Is like the clinicians only doing the biggest producing
yeah.
the revenue producing treatment. Then everything else is like not as important that the team can take care of, right? Because I don't believe that you could do best in everything.
Yeah. Yeah. Well, it's the same thing. Like if the physiotherapists do the high level work, right? All the
Yes.
other stuff, it should be like it should be that $20 hour task, right?
Yeah.
Get
Exactly.
someone, right? And then don't get them go home to do their home exercise program. Like do it within the clinic because they're not gonna do it. And then
They're not gonna. I'm one of those bad patients.
yeah, and then they end up saying that physiotherapy didn't work, right?
Yeah.
And they can't address the funding issue, the money issue,
Yeah.
right?
Yes.
So it's like I'm just like, oh my
Yeah.
god,
It's the accountability of the patients too. I mean, I think that's how you create that reappointment, because you
Hey
were talking
Claudia,
about
I'm
how
thinking
physiotherapy is slow.
forget you being a coach for a dentist. You should be a coach for a physical therapist. What do you think?
I could. I think it's more of like, this coaching business is not really restricted to a single
Yeah.
industry, right? Because it's like a mindset shift. Like, you're really like, addressing a clinician, pulling that person out of the clinician hat, and then having that business
Yeah.
sense.
Super, super
Yeah.
cool. So just before we wrap up, Claudia, how do people find out more about you and what you do and how you help other like practice owners to actually grow their practice?
They can find me on the LinkedIn. I do also have a website, the VIPpracticecreator.com.
Okay.
And also if you're a patient that wanted to visit us, you can also visit our office in Markham. It's Markham Dental. so there's always we're all over the internet, so they can find me for sure.
Okay, cool. Yeah, this is awesome. So thanks for being on the show, and we'll see everyone like next week, right? So
great. Thank you for having me.